A very good morning. Welcome to the video. I'm doing lab 1 video today. My name is Puneeta Kaur, Puneeta Kaur, Kaur, and I'll just quickly scan the room that I'm in. I used one of the rooms at the campus B2070, and that's my friend Karen. She will be my patient today, and that is my friend Stella. She would be helping for the video, and this is a 360-degree view. Okay, now giving this to Stella. Okay, so I would quickly check my briefing and ensure I sanitize my hands, sanitize my equipment, know my patient, and go in the room, introduce myself, make sure my equipment is clean, give privacy, make the patient comfortable, and introduce. Hi, my name is Puneeta. I'm one of the student nurses here. I checked a quick brief history and I understand about the rashes. I would be doing a head-to-toe assessment. Is that okay if I do so?
Yes.
It would take roughly around 10 minutes. Do you want to use the washroom?
No.
All right. And can I also check your name pad? Okay. I have the right patient with me. I'll give you some privacy, ensure you're comfortable to my level, and I would start it. Now, I would just ask you generally about your rashes and other symptoms that's happening. Now, can you tell me when the rash or when you noticed your rashes?
2 weeks ago.
Okay. And what did you do? Did you use anything? Did you do something about the rash?
No, I just slept on it.
Okay. So when you were sleeping, did it improve after you slept or did it not?
It didn't improve.
It didn't improve. Okay. Some rashes, apart from the rash that I see, do you see it anywhere else on any part of the body?
No.
Okay. And do you feel that a rash like this or symptoms like this have happened before this time?
No.
No? Okay. Do you feel that there's any pain around the rash?
Yes.
Okay. So if I ask you to rate your pain from 0 being no pain to 10 being the worst pain of all, what would be your rating?
2.
Okay. And what does your pain looks like? Like, is it sharp? Is it dull? Is it radiating?
It is dull.
It's dull. And how does the rash and the symptoms affect your life in general?
I don't go outside.
Yeah, it's the rash and understand. Thank you so much for sharing. I'll quickly proceed to my assessment now. Now, if I see generally, you look appropriate for your age, your body is well nourished, and there's no odor that I noticed. You're right now in the sitting posture, your sitting position, and your posture looks fine to me. And overall, I see no physical deformities that I notice. And if generally we are talking, you're maintaining eye contact, your facial expressions look fine, you're in a good mood, and you're maintaining an eye contact with me, you're dressed appropriately for the weather. Now, if Sarah, can you stand and just take 2 steps for me? Perfect. And then you can step back. Just have a seat. Thank you. So your gait and mobility looks steady, it's normal. And while you're talking to me, I noticed your breathing. I do not see any sign of distress. Your breathing is normal. And so very quickly, can you tell me your full name, Sarah?
My full name is Sarah Smith.
Perfect. Can you tell me where we are?
In the clinic.
Perfect. And can you tell me the date for today?
Today is June the 11th, 2025.
Perfect. So you're alert oriented ×3. Now, if I can quickly look and scan on your head and your general features, is it okay if I do?
Yes.
And while I'm pressing and checking, if you notice any pain, then do let me know. So I see a general your general head, the size looks normal, the shape is cephalic. If I happen to press slightly, do you have any pain anywhere?
No.
Perfect. No pain noticed by the patient and no lumps and lesions. I see no bumps as well. If I generally look at your hair are evenly distributed. The texture looks absolutely okay to me. And if I see generally your face, if you can take out your specs, and you can keep it here. I see the overall face is symmetrical. I see no bumps, lesions, any redness, any edema around. And if I happen to press, do you have any pain anywhere? Sorry about my hands being good.
No.
Okay. So no bumps, lesions found, everything's look okay. And if you can very quickly smile for me and you can show your teeth, perfect. And if you can also raise your eyebrows, frown a little, and shut your eyes tightly, open them up, perfect, and puff your cheeks, perfect. So your cranial nerve 7 is intact. Now after your eyes, after your face, I would quickly go on your eyes, and on a general note, I notice that your eyes are symmetrical, the eyelashes are evenly distributed. I also do not notice any redness, discharge, no blood vessels. It looks okay. Now I'll quickly look into your eyes and check more to your pupils. I see a size of 2 mm for both the pupils, perfect. I also see that both of them are round, they're both equal in size. I'll quickly see if it is okay. I'll put some light, okay? Just keep looking at the tip of my finger, and I see that they react to light, both of them, perfect. And I would now want you to look at the tip of this and keep noticing without, perfect, accommodating. The pupils are accommodating. And now I would want you to look at the tip again and go from here, perfect. So cardinal gaze is also absolutely fine. So cranial nerve 3 is intact for you. From your eyes now I move towards your ears. I notice on general that both the ears are good in shape. I do not notice any discharge. At this point of time I would touch it, okay, and let me know if you have pain. Pain anywhere?
No.
And pain here?
No.
So the auricle and the tragus looks okay. I would now inspect both your ears one by one. For otoscopic inspection, I'm putting pinna up and back, and I go really deep, and I see the external auditory canal, pink, nice, normal, no foreign body, no discharge notice. I also see tympanic membrane, pearl gray, and no foreign body discharge notice. I move to the other ear. I hope I'm not pressing too much.
No, it's okay.
Again, external auditory canal looks good, no foreign body discharge notice, and the tympanic membrane is also pearl gray, shiny, and no foreign body discharge notice. So ears looks absolutely fine. I'm coming to your mouth now. I notice lips are symmetrical, looks well hydrated, and I would very quickly use my opened tongue dispenser. Can you open your mouth for me? Perfect. I see your gums now. Okay, perfect. The gums looks good. There's no redness, no edema that I notice. If you can move your tongue outside and do perfect. The tongue is symmetrical. The tongue is pink in color, looks good. And I can see the tonsils +1 in size. Tonsils look okay, no edema notice, no lesions notice. The hard palate is whitish in color. I notice no edema, no lesions. The soft palate is also intact, hard palate intact. For soft palates, I do not notice any edema. Thank you so much, my dear. I would discard it now, and now I would move on to your nose. For the nose, I would very quickly see that the nose is midline, no crusting, no discharge I notice. And for the nose, if I can touch also your sinuses, is there any pain?
No.
So the sinuses looks absolutely without any pain and are nice, no tenderness notice. And for your nose, if you can close one of the nostrils and inhale and exhale, perfect. Close the one you used and then inhale and exhale. Excellent. Patent nostrils. And if you can also very quickly smell, here I have 2 different fragrances. Close the nostril and smell and tell me what it is.
Coffee.
Perfect. Close the other one and smell what it is.
Lavender.
Perfect. So your patent and smell test done. Cranial nerve 1 is intact. Thank you so much. I'll record and let the doctor know.
Okay, close, close, close.